Bismillahirrahmanirrahim. The quote of the day is a verse from the Holy Quran, and whoever relies upon Allah, then He is sufficient for him. Indeed, Allah will accomplish His purpose. Allah has already set for everything a decreed extent. Assalamu alaikum. I'm Dr. Nabeela Umar, and I'm going to present the topic of disease surveillance under the kind supervision of Professor Dr. Saida Afzal. The learning outlines is what is public health, what is disease surveillance, what are the various principles of surveillance, the various types of surveillance, the disease surveillance cycle, its importance, various disease surveillance systems, the various challenges, role of technology, recent updates, and at the end, multiple choice questions. Learning outcomes. By the end of this presentation, participants will be able to understand and explain surveillance systems and the importance in public health and various challenges faced during the surveillance process. What is public health? Public health is the practice of protecting and improving the health of families and communities through promotion of healthy lifestyles, research for disease, and injury prevention and detection and control of infectious diseases. A core function of public health is assessment, which includes disease surveillance. What is disease surveillance? It is defined as the ongoing systematic collection, analysis, and interpretation of health data essential to the planning, implementation, and evaluation of public health practice, closely integrated with the timely dissemination of these data to those who need to know. Surveillance may be carried out to monitor changes in disease frequency or to monitor changes in the levels of risk for specific diseases. It is the primary method through which federal agencies, such as in the United States, there is Environmental Protection Agency, which identifies contaminants of emerging concern. Introduction to disease surveillance. Proactive monitoring. Disease surveillance allows health authorities to proactively monitor the health of populations and detect emerging issues early. Targeted response. With timely data, public health officials can implement targeted interventions to control the spread of diseases. Evidence-based decisions. Surveillance data informs policy decisions and resource allocation to address the most pressing health concerns. Epidemiological principles of disease surveillance. Systematic data collection. Standardized reporting mechanisms ensure comprehensive and consistent data gathering across healthcare settings. Timely analysis. Rapid processing and interpretation of surveillance data enables quick detection of trends and outbreaks. Population-level insights. Aggregating data at the community, regional, and national levels reveals broader patterns and risk factors. What are the types of surveillance? There are 4 types: passive surveillance, active surveillance, syndromic surveillance, and sentinel surveillance. Passive surveillance. It denotes surveillance in which available data on reportable diseases are used, or in which disease reporting is mandated or requested by the government or the local health authority, with the responsibility for the reporting often falling on the healthcare provider or district health officer. Examples of reportable diseases include common sexually transmitted diseases, for example, syphilis, gonorrhea, human immunodeficiency virus. When passive reporting is used, local outbreaks may be missed because the relatively small number of cases often ascertained becomes diluted within a large denominator of a total population of a province or a country. However, a passive reporting system is relatively inexpensive and relatively easy to develop initially. Active surveillance. It denotes a system in which project staff are specifically recruited to carry out a surveillance program. They are recruited to make periodic field visits to healthcare facilities such as clinics, primary healthcare centers, and hospitals in order to identify new cases of a disease or diseases or deaths from diseases that have occurred. Active surveillance may involve interviewing physicians and patients, reviewing medical records in developing countries and rural areas, surveying villages and towns to detect cases either periodically on a routine basis or after an index case has been reported. Syndromic surveillance. An active or passive system that uses case definitions that are based entirely on the clinical features without any clinical or laboratory diagnosis. For example, collecting the number of cases of diarrhea rather than the cases of cholera or rash illness rather than measles. Because syndromic surveillance is inexpensive and is faster than systems that require laboratory confirmation, it is often the first kind of surveillance begun in a developing country. Sentinel surveillance. In sentinel surveillance, selected institutions are tasked with reporting on specific diseases. A sentinel surveillance site is a single or a small number of health facilities that are responsible for collecting data, monitoring of rate of occurrence of specific conditions to assess the stability or change in health levels of a population. It is also the study of disease rates in a specific cohort, such as in a geographic area or a population subgroup, to estimate trends in a larger population. It provides data on trends without full-scale population coverage. Data collection and reporting mechanisms. Healthcare facilities. Mandatory reporting of notifiable diseases by clinicians and laboratories. Population surveys. Collection of self-reported health data through questionnaires and interviews. Disease registries. Specialized database that track the incidence and prevalence of specific conditions. Surveillance system flowchart. Occurrence of health event, diagnosis, then the reporting sources, data recipients, which are on 3 levels: primary level, secondary level, and tertiary level. What are the components of disease surveillance? The components of surveillance and resulting public health action. The first step is the collection, then is the analysis, interpretation, dissemination, and then the appropriate response and action is taken. Number 1 is data collection, the systematic gathering of health-related information. The sources of the data collection can be hospitals, clinics, laboratories, and community health workers. Data can include case reports, laboratory tests, and surveys. What type of data can be included? This can be case-based, aggregated, or event-based data. The challenges related to the data collection can be completeness, accuracy, and timelessness, can be affected by resource limitations and reporting delays. The second step is data analysis. This is the processing and examining data to understand the trends and patterns. Epidemiological methods such as calculating incidence and prevalence rates, identifying clusters, and analyzing spatial and temporal patterns. To detect the outbreaks, assess disease trends, and identify at-risk population can be the objectives of data analysis. Various tools are used for data analysis, such as statistical software, geographic information systems for mapping, and other analytical platforms. Third is the data interpretation, making sense of analyzed data to assess its public health significance. Interpretation involves understanding context, comparing data with historical trends, and correlating with demographic, environmental, and social factors. To determine the likely cause, predict potential spread, and evaluate severity of risk level. The importance of data interpretation is this step is crucial for transforming data into actionable insights for decision making. The fourth step is data dissemination, sharing surveillance findings with relevant stakeholders. Public health officials, healthcare providers, policymakers, and sometimes the general public is included in the data dissemination. Reports, alerts, bulletins, dashboards, or press releases are the process by which the data is disseminated. This data can be disseminated on a routine basis or urgent basis. The goal of data dissemination is to ensure timely information to reach those who need it to take preventive or control measures. The fifth step is the response, the public health actions taken in response to surveillance finding. What type of responses are there? There are immediate responses and preventive actions. Immediate responses is the initiating isolation, quarantine, or outbreak investigation if a disease poses a significant threat. And preventing actions include the vaccination campaigns, public health education, vector control. Long-term intervention includes the policy updates, resource allocation, and capacity building. Effective response often requires coordination across different levels of government and international agencies. The goal of the response and action is to contain the disease, mitigate its impact, and prevent the future outbreaks. What are the uses of public health surveillance? To assess and monitor the public health problems, to estimate the magnitude of the problem, useful in setting priorities to facilitate planning, portray the natural history of a disease, detect the epidemics or define a problem, generate hypotheses, stimulate research, evaluate programs, control measures, and detect the changes in health practices and services. Disease surveillance system. There are various disease surveillance systems working on the global, regional, and national level. For example, on the global level, World Health Organization surveillance systems are present. For example, Global Outbreak Alert and Response Network. This is a network coordinated by WHO to support the international outbreak responses, providing rapid response capacity and technical expertise. Another one is the Global Influenza Surveillance and Response System. which monitors and analyzes the global influenza activity and is central to flu vaccine strain selection each year. Another one is the International Health Regulation, a legally binding agreement between 196 countries to prevent and respond to public health threats that can cross borders. Surveillance system on the regional level. For example, in Africa, there is an integrated disease surveillance and response system, which is a regional framework developed by WHO Africa region and the CDC for strengthening and surveillance and response in African countries. In Asia, there is an Asia-Pacific strategy for emerging diseases and public health emergencies. It's a regional strategy by WHO for the Asia-Pacific region to strengthen national public health system with a focus on early detection, risk assessment, and response to public health emergencies. In Europe, there is a European Center for Disease Prevention and Control, which provides an integrated disease surveillance and risk assessment for European Union countries focusing on communicable diseases. The national surveillance system working in Pakistan are the National Institute of Health, which operates a disease early warning system that monitors priority infectious diseases and outbreaks across Pakistan. It provides the data for action, supporting response to disease outbreaks, including polio and dengue. There is the other polio surveillance program, whose purpose is it's a specialized surveillance program aimed at eradicating polio virus in alignment with the Global Polio Eradication Initiative. Another example is the Disease Surveillance Program, which is a national initiative to monitor and respond to dengue outbreaks with real-time data collection on dengue cases. What are the various emerging challenges in disease surveillance? Number one is the globalization and rapid disease spread. High levels of international travel and trade can rapidly spread infectious diseases across borders, making containment challenging. Crowded urban environments facilitate faster disease transmission, complicating surveillance and control measures. Number two is the emergence of new and re-emerging diseases. Emerging infectious diseases like COVID-19 and Ebola present unique surveillance challenges, especially in detecting outbreaks early. Diseases previously under control, for example, measles and tuberculosis, are re-emerging due to factors like vaccine hesitancy and drug resistance, requiring continuous and adaptable surveillance. Antimicrobial resistance. Surveillance for drug-resistant infections is complex and costly, often requiring sophisticated laboratory facilities and skilled personnel. Data privacy and ethical concerns. Surveillance requires personal health data, which can raise privacy concerns, especially in sensitive cases like HIV, AIDS, or mental health. Human resource limitations. Surveillance requires trained epidemiologists, data scientists, and laboratory technicians. Many regions face shortages of such professionals. High-pressure environments, especially during pandemics, can lead to burnout and high turnover among public health workers, impacting surveillance capacity. Role of technology in disease surveillance. Technology plays a transformative role in modernizing disease surveillance, making it faster, more accurate, and responsive. Electronic health records. Electronic health records allow for automatic and real-time data collection from healthcare providers, enabling rapid reporting and minimizing delays. Mobile health applications. Mobile applications allow healthcare workers and even the public to report symptoms, helping detect outbreaks early. Geographic information system. Geographic information system technology allows for precise mapping of the disease cases and spread patterns, helping public health officials identify hotspots and allocate resources effectively. By overlaying environmental and demographic data, geographic information system can also help predict where outbreaks might occur based on climate conditions, population density, and other risk factors. Artificial intelligence and machine learning. Artificial intelligence models can analyze historical and current data to forecast outbreaks, helping public health agencies take preemptive actions. Genomic surveillance. Advances in genomic technology enable quick sequencing of pathogens, for example, COVID-19 and Ebola virus, helping track mutations and understand how disease spread. Digital dashboards and public health portals. Public health agencies now use dashboards, for example, WHO COVID-19 dashboard, to visualize disease trends, making data accessible and transparent to the public and stakeholders. Portals also help keep the public informed, building awareness and encouraging participation in surveillance activities like reporting symptoms or vaccination uptake. Recent updates. Strengthening the global health security by improving disease surveillance in remote rural areas of low-income and middle-income countries. The COVID-19 pandemic has underscored the need to strengthen national surveillance systems to protect a global connecting world. In low-income and middle-income countries, zoonotic diseases surveillance has advanced considerably in the past 2 decades. But there is limited disease surveillance in the remote rural areas, which is a crucial gap in global health security. Practical solutions on how to implement surveillance efficiently in these resource-limited area and logistical challenging settings have yet to be discussed. This study highlights the need for a more holistic approach to disease surveillance and how this outcome might be achieved. Inadequate surveillance in remote areas can cause delayed detection and ineffective response to disease outbreaks, increasing the risk of pandemics due to latent amplification, regional and global levels, and animal trade. Advances in diagnostic testing, along with the adoption of One Health approach that fosters collaboration between human, animal, and environmental sectors, can make zoonotic disease surveillance in low-middle income countries more accessible, cost-effective, sustainable, and connected across geographical scales. The study has described a 6-step approach for better and efficient surveillance. Step number 1 is to engage all the stakeholders at the global, national, country, and rural and community level, which can include the community health workers, wildlife rangers, veterinarians, clinicians, epidemiologists. The step number 2 is human and animal syndromic surveillance system. Step 3 is to increase the regional clinical capacity. Step 4 is to increase the regional diagnostic capacity. And step number 5 is to establish the multidisciplinary data management and analysis system. And step number 6 is to engage the governments and international stakeholders. This is how, by a 6-step approach, the surveillance system in the rural health areas can be efficiently improved. Artificial intelligence in public health, the potential of epidemic early warning systems. The use of artificial intelligence to generate automated early warnings in epidemic surveillance by harnessing vast open source data with minimal human intervention has the potential to be both revolutionary and highly sustainable. There are some current epidemic intelligence systems working, including the ProMed Mail, Health Map, Epidemic Intelligence from open sources, Blue Dot, MetaBiota, the Global Biosurveillance Portal, EpiTwitter, and EpiWatch. The COVID-19 pandemic has promoted substantial investment in artificial intelligence tools for epidemic surveillance. For example, the United States Centers for Disease Control and Prevention established the Center for Forecasting and Outbreak Analytics, and the United Kingdom announced its Global Pandemic Radar. In Berlin, the WHO further established the Pandemic Hub, which is co-founded by the German government. The CDC established an open source tool called EpiTwitter in August. The unprecedented 2022 monkeypox epidemic in non-endemic countries provided a test case for using learning from epidemic intelligence system responses to COVID-19 pandemic. All systems reported on monkeypox, however, are aware of two special initiatives. Health Map created a monkeypox dashboard with daily updates of case control, and EpiWatch created a weekly summary of syndromic surveillance for rash and fever illnesses that could be monkeypox, misdiagnosed, and other illnesses. Artificial intelligence enables early identification and intervention, allowing the early management of newly emergent epidemics to feasibly result in eradication. The key features of optimized artificial intelligence system are rapid intelligence drawn from open source data to generate high-level and early epidemic alerts compared with traditional surveillance without the need for human reporting. These alerts can be followed up with formal investigation and traditional surveillance methods such as laboratory confirmation by public health authorities. The capability to rapidly and globally identify key serious syndromes that may result from new emerging infections or biowarfare events. The ability to address the uses of censorship of reporting and reliance on human reporting and challenges faced by weak health systems. Multiple choice questions. Number 1, Pakistan is facing a surge in cases of tuberculosis. It is ranked as the 5th highest TB burden country. Ali, a healthcare worker, is working in New Hospital, Lahore. He is required to report cases of tuberculosis by law. This is an example of which type of surveillance? Number A, syndromic surveillance. B, active surveillance. C, sentinel surveillance. D, passive surveillance. Or E, risk-based surveillance. The answer is D, passive surveillance. Number 2, Jinnah Hospital, a large government setup in Lahore, is selected to monitor specific diseases in a region without full population coverage. This is known as A, syndromic surveillance, B, sentinel surveillance, C, passive surveillance, D, laboratory surveillance, E, none of the above. Anyone? B. Sentinel surveillance is the answer. Number 3. For rapid detection of flu outbreaks, a hospital uses real-time health data without waiting for lab confirmation. What type of surveillance is this? A. Passive surveillance. B. Syndromic surveillance. C. Active surveillance. D. Sentinel surveillance. Or E. Field surveillance. The answer is B. Syndromic surveillance. MCQ number 4. Which element is essential for transforming surveillance data into effective public health action? A. Data collection only. B. Data analysis and interpretation. C. Data collection and dissemination. D. Dissemination and analysis. E. Response coordination. The answer is B. Data analysis and interpretation. MCQ number 5. A recent increase in cases of dengue fever has been reported in various regions of Pakistan. The Ministry of Health mobilizes its disease surveillance teams to gather data on the outbreak, identify affected areas, and implement control measures. This initiative involves the collaboration between local health departments, hospitals, and community organizations. In this scenario, what is the primary importance of the disease surveillance system for managing the dengue outbreak in Pakistan? A. It allows for the development of new treatments for dengue fever. B. It increases the number of healthcare professionals. C. It focuses solely on the educating of the public. D. It standardizes healthcare practices. Or E. It helps identify patterns and risk factors to inform targeted interventions. The answer is E. It helps identify patterns and risk factors to inform targeted interventions. Number 6. A surveillance system relies on genomic sequencing to detect new variants of a virus during an ongoing pandemic. However, this system faces significant delays due to limited laboratory facilities and a shortage of skilled personnel. Which of the following challenges is most likely affecting the efficiency of this surveillance system? A. Technological gaps and infrastructure issues. B. Public mistrust and data privacy concerns. C. Underreporting and incomplete data. D. Climate change affecting disease spread. Or E. Lack of global coordination and standardized procedures. The answer is A. Technological gaps and infrastructure issues. MCQ number 7. A health department notices a resurgence of a previously controlled infectious disease in a particular region, partly due to declining vaccination rates. Social media analysis reveals misinformation about vaccine safety spreading within the community. Which emerging challenge is most relevant in this condition? A. Antimicrobial resistance. B. Globalization and increased travel. C. Public mistrust and vaccine hesitancy. D. Data integration issues across health system. E. Surveillance data privacy concerns. C. Public mistrust and vaccine hesitancy is the answer. MCQ number 8. A public health department deploys mobile health applications for healthcare workers to report cases of respiratory illness in remote areas. This application enables faster data collection and reporting compared to traditional methods. Which role of technology in disease surveillance is most likely being addressed here? A. Enhancing data integration across healthcare system. B. Facilitating genomic sequencing of pathogens. C. Improving real-time data collection and reporting. D. Enabling social media-based outbreak detection. Or E. Ensuring ethical handling of patient data. The answer is C. Improving real-time data collection and reporting. MCQ 9. Our National Health Agency launches an online dashboard for COVID-19 showing the real-time case counts, recoveries, and vaccination rates. This platform is accessible to public, providing transparent and timely updates on the pandemic. What role of technology in disease surveillance does this scenario best illustrate? A. Enabling public participation in syndromic surveillance. B. Collecting environmental data to predict disease spread. C. Integrating laboratory results for real-time analysis. D. Enhancing transparency and public awareness through digital dashboards. E. Automating case-based data collection for rapid response. The answer is D. Enhancing transparency and public awareness through digital dashboards. MCQ number 10. The Ministry of Health in Pakistan is working to enhance its disease surveillance system to better track and respond to outbreaks. They have implemented a new electronic reporting system for healthcare facilities across the country. This initiative aims to improve real-time data collection, analysis, and response time. What is the primary objective of enhancing the disease surveillance system in Pakistan through the implementation of an electronic reporting system? A. To improve the accuracy and spread of disease outbreak detection and response. B. To reduce healthcare costs associated with disease management. C. To increase the number of healthcare facilities available nationwide. D. To provide training programs for healthcare workers only. Or E. To decrease the incidence of non-communicable diseases. The answer is A. To improve the accuracy and spread of disease outbreak detection and response. This is the key to the MCQs. This is the YouTube channel where the presentation will be uploaded. Thank you.